Hi everyone. I'm excited to share the preliminary findings from our systematic review looking at the prevalence of cannabis use during pregnancy. I was fortunate to lead this project as part of my undergraduate thesis in the Bachelor of Health Sciences program here at McMaster University. The topic of cannabis in pregnancy has been a subject of discussion for many years, especially with the recent federal legalization of recreational cannabis use in Canada. It is well known that cannabis use during pregnancy may be harmful to the developing fetus and may also contribute to birth defects or low birth weight. Therefore, understanding the prevalence of cannabis use among pregnant women is really important to help guide public health efforts and also target resources towards potential high-risk populations. The scope of this systematic review was very broad to capture many studies as possible to explain our expected heterogeneity in the data. We performed our literature search in all the major databases up until December 2020. Our inclusion criteria required the studies to, number one, report the prevalence of cannabis use specifically during pregnancy, not lifetime or historical use. Two, be a cross-sectional, prospective, or retrospective cohort study design. Number three, the primary focus of the study needed to be pregnant women and not solely infants or babies or children. Number fourth, have a minimum sample size of 200 participants. Our review also assessed each included study for risk of bias in the following domains. Number one, whether or not the study population was representative of the general public. Two, their data collection procedures. Was each participant systematically asked about their cannabis use, or was it passively recorded in data or charts? Three, the timing of measuring cannabis use during pregnancy. Was it only the first trimester, like their first visit to a healthcare professional, or was it asked repeatedly at every visit until delivery, which would have been a more accurate measure to capture one's use for the entire pregnancy? And since some only reported at the first trimester, that might have underestimated the prevalence for the rest of pregnancy. Four, the validity of outcome measure. Was it self-report, urine, or meconium? And believe it or not, self-report, we believe, is the most accurate measure for the entire length of pregnancy because most biological tests only go back a few weeks. And lastly, the degree of missing data, because of course, that can also influence the study, risk of bias. Now, taking a look at our flow diagram, out of 10,411 records screened, there were 257 articles eligible for inclusion in our review. However, each one of these studies was then assessed for overlapping data. And you may be wondering what I mean by this. It's essentially when you have two different articles that were published with information from the same database or longitudinal cohort. So of the 257 included studies, over 1/3 of these had overlapping data, resulting in a final total of 161 studies included in our final analysis. There were lots of differences in outcome measures performed to assess cannabis use in all of our included papers, ranging from self-report to urine tests, meconium, or even hair samples. And this factor acted as one of the big limitations of our study. We also analyzed the status of cannabis laws in each study population to see if cannabis legalization had any impact on its prevalence. And our results indicated that there was no statistically significant difference in cannabis use between jurisdictions with legal laws compared with those with illegal laws. Further, when looking at the overall pooled estimate of the prevalence, we got 8.1% as the big number you see on the poster. Now, it's important to interpret this value with extreme caution because it contains estimates ranging from 0 all the way to 47%, with lots of heterogeneity. With our large number of included studies, we were able to conduct various subgroup analyses to help explain this variability. The two highlighted on this poster illustrate that when divided by tobacco and alcohol users versus their non-users, we see a significant difference in cannabis use. Particularly, 25% of the women who used tobacco during pregnancy and 22% of those who drank alcohol also used cannabis during pregnancy. This is compared to the 5% and 8% prevalence among those who didn't use any of these substances. Currently, our team is still conducting some more analyses to continue explaining some of the heterogeneity in the data, but I was happy to share these preliminary findings with you today. Thank you for listening to my brief presentation, and feel free to contact me at my email on the poster, neumarks@mcmaster.ca, if you have any more questions or comments about this project. And I wanted to give a special thank you to my research team, Jane Jomi, Lee Wang, Rachel Kuban, and my amazing supervisor, Jason Bussa, for their contributions towards this project.